the power of vaccines, looking from a cardiovascular perspective. Um, I never really thought too much about vaccines in general, and Aditi has put together a wonderful presentation with her team, and I don't think any. I think we always took vaccines for granted, but it is probably one of the most powerful aspects of medicine that we've undervalued, and that because they're just that good over time. And I once heard this expression: "A good doctor treats disease, a better doctor prevents disease." So we're going to learn a little bit about vaccines in general. So tell us more, Aditi.
Yeah, so today we're going to be discussing vaccines. We'll look at what vaccines are, why they're important, adult and childhood vaccination schedules, COVID vaccines, and then vaccines in relation to the heart, because there's a couple of studies that talk about the effects of vaccines on like protective effects for the heart. So starting off, let's have like a quick little introduction to vaccines. So the World Health Organization defines vaccines or vaccination as a simple, safe, and effective way of protecting you against harmful infections or diseases before you come into contact with them. So essentially what vaccines do is that they work by using your body's natural defense system, your immune system, to build resistance to certain infections, and they prime the immune system through antibody production. What they don't do is cause the disease themselves or put you at risk for future events. So overall, a relatively safe, simple, and effective way to protect you. So there are different types of vaccines. The inactivated vaccine is probably what you think of when you think of traditional vaccines. So basically you have a
Aditi,
dead
can you just
virus.
go back one slide? You mentioned something is that you're using your body's defense system. We're not giving you a defense mechanism, or what's going on there a little bit? I mean, I'm just trying to figure this out here. This is kind of interesting, because I guess we're going to learn a little bit more about that in general. So vaccines, it's kind of interesting. We're putting something into your body that really stimulates your body to fight infection much better. It's really interesting. And so, when I first thought of vaccines, I thought we're getting some super Drano, some super power into your body system. It's not really the case at all. So you're not going to grow a third limb from vaccines and things of that nature. And what we're going to learn is that you need a good immune system, and how to make your immune system stronger is by being younger and healthy and keeping yourself really vibrant and healthy. That's step number one. And step number two is vaccines come out of your system very, very quickly. So you're not going to go a third arm or things of that nature as well. But really, the principle of vaccines is to put something in front of your immune system that is called foreign. So when it comes back again, you have a great defense against it. I guess it's like a hockey team. If you play the same team 20 times, you get better at knowing how to play that team better. So thank you for sharing that.
Yeah, for sure. That's definitely what the principles of vaccines are based on. And we'll actually be talking about that in more detail in terms of how it primes your immune system in the upcoming slides. So back to discussing types of vaccines. The inactivated vaccine is just a dead virus or bacteria. Perhaps they grew it in the culture and then killed it off. That's injected into you. So because it's dead, it can't really do anything, but your body can recognize it as like foreign matter and start producing antibodies so that if you ever come across a live version of that virus or bacteria in the future, your body knows how to fight it off. And inactivated vaccines, one of the most common types is the intramuscular polio vaccine. Next, there's attenuated vaccines. These can also be lumped in with traditional vaccines. So it's live attenuated. Basically what this means is they've taken a live pathogen, they've significantly weakened it to the point where it can't actually cause an infection, but it's still not dead yet. And this is what gets injected and your body recognizes it and builds antibodies to help protect you if you ever encounter that pathogen in the future. And common examples for that would be smallpox or the measles vaccine. Then there's toxoid vaccines. So this is when the pathogen secretes something that causes the disease, and that's called a toxin or a toxoid. So a common example is tetanus, where they actually take the tetanus toxoid And that's what the basis of the vaccine is, that your body builds immunity to that particular chemical component rather than the pathogen itself. And finally, there's subunit nucleic acid vaccines. So this would be the mRNA vaccines, which I'm sure we're all familiar with the term, as these are the types of vaccines that are available currently in Canada as COVID vaccines. So that would be like your Pfizer and your Moderna. So just some common vaccines. So chickenpox, diphtheria, the flu shot or influenza vaccine, hepatitis A, hepatitis B, HIV, HPV, measles, the list goes on and on. There's several really good vaccines that have been developed against a variety of different diseases, and they can be quite protective. So I do have a little graphic on this side that kind of talks about the protective power of vaccines. So for instance, polio is a disease that could cause permanent damage to your muscle controlling nerves. Because of the polio vaccine, Canada has actually been polio free for over 20 years. And then if we look at diphtheria, this was previously the most common cause of death in children under the age of 5. Since vaccines were introduced, we've seen about 100% decrease in the number of cases in Canada. So similar situation for mumps, about a 99% decrease in cases since the vaccine was introduced. And smallpox, which is often regarded as the first vaccine that was developed, that had a 30% mortality rate before the vaccine, and it's been eradicated worldwide for more than 30 years now. So just to discuss some cases of vaccine efficacy a little bit further. So some diseases that we've seen a significant decrease in cases are diseases like measles. Unfortunately, we can't say we've eradicated measles. There are still outbreaks that pop up from time to time due to a lack of vaccination. There's also pertussis, which is whooping cough, and mumps. We've seen significant decreases in those cases. And then I have an image on the right. This is actually the last person to be documented with natural smallpox back in 1977. So that was the last time we saw a case of naturally occurring smallpox. It's been eradicated ever since, which really speaks volumes about what vaccines are able to do if everyone is able to get them.
So I guess one analogy to think about, if we just, or you keep that slide, that's a wonderful slide, is that it's like the car. We now had, we're going to electric cars, we're going to better cars, more fuel efficiently cars. The first Model T was a wonderful invention at the time. And so the vaccine you get today is work based on about 50 years of technology. Even longer than that, actually. It's sort of like, so you're going to talk about the Model T vaccines of the past, but the vaccines of today are just that much better, that much safer. And so when people say this, vaccines are being developed very rapidly, that's because people have put a lot of work for the last 50 to 100 years to make this work. And so this is a wonderful track record. And probably, to be honest, is that vaccines have saved more lives than all our healthcare providers and prevent a lot of misery as well. So I'm very grateful. And diseases that were deadly and iron lungs of the past and different pandemics in the past are less likely to occur. They still can occur, as we're unfortunately surprised to find out what, but it shows us the power of science and technology over hundreds of years. Thanks so much. Tell us more.
Yeah, so this is just a graph of the United States mortality rates. And as you can see, each time a vaccine was introduced, there was a significant dip over time. So we can see that the deaths per 10,000 slowly decrease over the years, and they get even smaller as different vaccines are introduced because you're not having fatalities due to these diseases as you're able to be protected from them. So diseases vaccines can prevent. We want to just give you a visual of the reality of these diseases before vaccines were introduced. So on the left, that's a child with measles. Measles is an infection that is incredibly infectious. And it was often very deadly in children who were malnourished. And measles is kind of unique in that it causes this phenomenon called immune amnesia, where it impairs your immune system for months after you've had it. So oftentimes, even if you didn't die of measles, the disease itself, you would die from secondary infections you caught after the original measles disease. And then on the right, we have this example of polio. So I'm sure many of you have heard of the iron lung. So that was definitely a reality due to the damage to the muscle controlling nerves as a result of the polio infection. And this is just a visual of smallpox, a disease that we successfully eradicated with vaccines, just to give you an idea of what it was like before the vaccine came about. So just a brief discussion on mortality to kind of highlight how deadly these diseases used to be before we were able to introduce vaccines to significantly reduce the amount of reported cases. So the Spanish flu was a massive influenza epidemic that took place from 1918 to 1920. There were 500 million estimated cases and between 25 to 50 million estimated deaths. And I bring this up just because now we have yearly flu shots, and the flu vaccines didn't actually come about until the 1930s. That's when they started becoming widely available in the United States. And it just kind of makes you think, what might the epidemic have looked like if we were able to introduce a flu vaccine back then? So next on to polio. Polio caused 15,000 cases of paralysis and 19,000 cases of death a year in the United States before the introduction of the vaccine. Smallpox was causing 48,164 cases and 1,528 deaths a year in the United States. Immunizations overall, it's estimated that they prevent 2 to 3 million deaths a year. Yet despite having effective immunizations, rates of unvaccinated individuals are on the rise. And this results in approximately 1.5 million deaths a year from vaccine preventable diseases. And the last one I want to mention is measles, which I already alluded to can be quite deadly because of that immune amnesia effect. And this is kind of an example of how vaccine hesitancy can cause a reemergence of a disease, because we are seeing cases on the rise. There have been more outbreaks of measles in the past couple of years due to halts in vaccination campaigns or people not wanting to get vaccinated. And this can especially be seen in countries where the healthcare system is so overwhelmed by COVID that they've had to actually stop their mass vaccination campaigns. So people are just not able to get the measles vaccine, and we've seen outbreaks cropping up in these different countries.
So Aditi, it's kind of interesting about the measles vaccine. The other thing too is that viruses mutate, and some of the things that's happened is that there's new strains of measles, so we have to adapt our vaccines to deal with that. So that's one of the issues too as well. When you said that we have 1.5 million deaths a year that's preventable by vaccination, is that around the globe? Is that just in the United States?
Yeah, that's global.
So vaccines, basically unvaccinated people have an extra 1.5 million deaths per year globally. Wow. And they prevent right now they prevent 2 to 3 million deaths a year right now globally around the world. Is that what those numbers are?
Yes.
Wow. Amazing. Thank you.
So why exactly do we need vaccines? Well, this is just a graph to highlight how our immunological memory works. So you get exposed to a disease for the first time. As you can see, there's a bit of a lag phase because it takes time to recruit your adaptive immune system, which is the one that builds the antibodies. So during that time, your body's innate or intrinsic defenses are trying to fight off the infection. And when you're finally able to get that antibody production, you see this primary immune response. Now, what happens after this primary immune response is you produce a lot of these plasma B cells that are able to produce these antibodies to fight off the infection. And then you go through a contraction phase. So the best of those plasma B cells, the strongest ones, end up surviving, and these become your memory cells. So the next time you're exposed, which is the second exposure right here, you see there's no lag phase. You actually mount a quicker and much better secondary immune response because these memory cells were the best fighters of the original bunch. They recognized the pathogen right away and knew what to do. So the thing is, this initial exposure doesn't have to be you getting infected by a disease. The initial exposure can be mimicked with a vaccine. So if your initial exposure is the vaccine, so for example, I get a COVID vaccine, I'm initially exposed to that spike protein, my body learns how to produce antibodies against it. if I end up catching COVID in the future, I'm going to have this secondary exposure, secondary immune response. So instead of having to go through the initial phase and not knowing what kind of antibodies I'm going to develop, whether I'm going to be strong enough to fight off the infection, I can immediately have this amazing immune response because the vaccine has primed my body to have these really strong antibodies available in case I'm presented with that pathogen again. So they can quickly recognize it and fight it off.
So our body's pretty amazing. So it recognizes what's part of us and what's foreign to us. And so the bacteria or the virus is conceived as foreign. The body says, we don't like it, let's attack. And then now you have to be able to generate immune response. So if you have no immune system, and some people, for instance, let's say who have cancer, are getting drugs to suppress their immune system, they may not be able to go for vaccines, and so they'll be more likely to be ravished by infections. And so one of the reasons to vaccinate ourselves is to protect people who cannot truly be vaccinated. And to be honest, right now is that there really is no contraindication to the COVID vaccine outside of basically people who can't generate an immune system. There's something called PEG, which is a part of the vaccine that can develop an allergic response to, but that's pretty darn rare, and that can be really treated. And so I'm really impressed that for your immune system to recognize something as foreign, and the vaccine gets that second hump there really quickly, so you have more fighter cells against something that's infectious. And so it's hard to overwhelm, but you can still overwhelm the system as well. Remarkable how the body works. Any of your thoughts about that, Stuart? Anybody else out there? And I think you explained it extremely well. Is that by giving a weaker form or a part of a virus or bacteria, you allow the body to develop an immune response to this, and so when it actually sees the bacteria or the virus, it's ready to attack on day one. So it's like saying the best defense here is a good offense. So you have preparations, you have your body ready to fight. I'm not sure if we're going to talk about this, Didi, is that how our immune system works over a lifetime. Are we talking about that at all or not really today?
A little bit, not specifically. In general, your immunity tends to decline as you age.
Yeah.
So and there's also something to be said for how long these antibodies are there circulating in your body after like X amount of years, depending on the antibody. Their levels start to decline, and that's why we have things like booster shots.
Yeah. It's interesting you mentioned the Spanish flu. There's a few survivors of the Spanish flu, and they still have immunity to, or not immunity, but at least they have antibodies still available. So there's still memory from the Spanish flu for some of the survivors right now. What I learned, a general rule is starting the age of 50 years of age, your immune system starts to decay. And by 60, there's actually a much bigger decay over time. So that's why things like shingles becomes more apparent, is that you unusually get shingles before the age of 50 years of age, unless you have a weakened immune system, let's say from cancer or chemotherapy. And that's why shingles vaccines, for instance, in most vaccines, you want to vaccinate when your immune system is strongest. And so somewhere around the age of 50, it starts to wane, and 60, it gets much worse. Now, do you know when you're first born how good your immune system is, and how the first few years of life about your immune system? Do you know much about that at all?
Yes. So when you're born, your antibodies that you have are from your mother, and that gives you about 6 months of protection. After that, you're kind of on your own. And there are only certain antibodies that the mother can pass on to the child. So that also influences when certain vaccines are recommended. And we'll talk about that when we get to like the vaccination schedule in a couple of slides, because you'll see that different vaccines are recommended at different time periods in your life.
It's quite amazing is that I once saw this beautiful picture of grandpa and a little toddler walking down the street together. And basically, a toddler has a lot more immunity because they got a lot more fighting immune cells compared to a 75-year-old grandpa. And so, so your immune system will weaken over time. So you want to strengthen it as much as you can. And but this concept of prime and boost is very, very important, is that you want to prime your system to recognize things that are foreign to your body, do it early, and sometimes you may need a booster effect. And it's interesting, some vaccines are good for life and some decay very quickly. And we're going to talk a little bit about that more. Thank you for sharing that.
Yeah, so on that topic, let's start to discuss vaccination schedules. So in Ontario, if you just Google vaccination schedule, you'll come up with a chart that kind of shows you what vaccines you're supposed to be getting and when. So if we take a look at this chart here, so you see at 2 months, you're eligible to get the diphtheria, tetanus, pertussis, polio, HIV, pneumococcal, rotavirus vaccines. You see a little bit later is when you can get the measles, mumps, or rubella, the MMR vaccine. That's recommended around 12 months. And this one's actually related to how long you have aspects of the mother's immunity. It's recommended you take it after that immunity fades to have the best possible response. Then we see at 18 months, you might need another booster, and you need them well into adulthood as well. So 14 to 16 years, you're taking another DTP shot. Typically HPV or human papillomavirus, that's something that they would vaccinate you against in grade 7 and 8. Hepatitis B also during grade 7 and 8. I remember them coming to our schools and doing all the vaccination campaigns there. And when you go into adulthood, every 10 years, you might need the tetanus shot, and DTP, usually 1 booster is required over the course of your lifetime. So vaccines for adults, we think of vaccination as something that we do as children, but it's actually something we require as adults as well. So as an adult, these are the free vaccines that you can receive, so they're covered by the government. Your tetanus, diphtheria, pertussis once in adulthood, the tetanus and diphtheria every 10 years, your flu shot every fall, pneumococcal at age 65, and then shingles. So the website for like Public Health Ontario says 1 dose between the age of 65 to 70. Some people take it in their 50s as well.
So this is quite interesting. This is as you get older, your immune system gets weaker. So this is some recommendation, is that you want to treat when you need it the most. But I think there's more and more discussion right now is that around the age of 50, your immune system starts to waver. And so I think many of us are thinking about getting vaccinated earlier while you still have a really good immune system. And then, for instance, is that there is something called Prevnar for pneumococcal pneumonia. When I was younger, I had my tonsils taken out. I had recurrent ear infections. And it turns out is that I didn't need to have my tonsils taken out. If I got vaccinated against pneumococcal pneumonia, I wouldn't have had all these ear infections, and I wouldn't, and that's actually gone away. So we don't actually take out tonsils and adenoids anymore. We actually vaccinate. Very interesting is that the people, the kids that are being vaccinated right now, they're still showing immunity to pneumococcal pneumonia, to the subtypes that's being vaccinated. And so you're going to see a lot more thinking, and I've thought about this a lot more. For instance, I was 61 when I got my first dose of shingles. I'm going to get my second dose soon. And I'm going to get my pneumococcal pneumonia earlier than later, because as I get older, my immune system is going to weaken. And I might need to get a booster later, may not do, but I'm going to really learn more about that. So I think you showed us, those iron lungs, the horrors of infectious disease and how that can be largely preventable. I kind of wish I had a vaccination against heart disease. I don't, but we do have vaccines that are very effective and very safe. And we'll talk about some of the off-target lesions a little bit later, but this is a remarkable story based on about 100 years of work. And so the vaccine you get today is based on technology that's been developed over many, many years. And I underappreciate the value of vaccines. I'm not going to make that mistake ever again. I hope you don't.
So why do we have the vaccine schedule that we do? Well, disease experts and doctors determine the timing of vaccines by balancing two factors. So the age when the body's immune system will provide optimal protection for the vaccination. So for instance, we mentioned that MMR vaccine is recommended at 12 months, as that slight immunity you might have left over from your mother during pregnancy could make the vaccine less effective if you get it earlier. And the age at which you're at the highest risk for that particular disease is also a factor they use in determining this vaccine schedule. So that's why you would get the Shingrix vaccine later on in life rather than earlier on. And vaccine boosters for the DTP and the pneumococcal vaccine are recommended in adulthood as protection, because these vaccines can wear off over time. So basically you'll produce antibodies based on your vaccination, but those antibodies only circulate for a certain amount of years or a certain amount of time in your system before they start to deplete. So that's kind of the logic behind a booster shot. It's to give you another little exposure so you can kind of develop more antibodies to help fight off the infection. So how do you know if you had these vaccines or you need vaccines? Well, you can check with your local public health unit. You can log into Public Health Ontario. You can use provincial websites to determine what vaccines you're eligible for. You could also connect with your family physician, and make sure you keep your receipts or confirmations from vaccine appointments, just so that you have your own record. So now we'll briefly talk about COVID vaccines. Obviously very topical, since that's something that's going on right now. So the types of COVID vaccines, there are two main groups that we had available in Canada. The one being the mRNA. So this is your Pfizer and Moderna. So mRNA is a nucleic acid sequence that helps your body build proteins. So basically how these vaccines work is you're giving yourself the mRNA for the spike protein, which is how the virus enters your body, and you build antibodies towards the spike protein. The other type of vaccine is the viral vector vaccine, so a safe virus carrier. So in the case of AstraZeneca, that was a ChAdOx3 adenoviral vector, which can't affect you on its own. It is a carrier for the spike protein gene. That's what's delivered to your body, and then your body builds antibodies. So the AstraZeneca and like Johnson & Johnson were available at one point. Now we mostly have the Pfizer and Moderna. So this is just an overview of the different types of the COVID vaccines. And because Pfizer and Moderna is what we have readily available, I'm going to talk a little bit more about how that vaccine works. And we do have an entire video on COVID vaccines as well. So if you're looking for more information, please go check that out. So the mRNA that encodes for the spike protein is packaged in a lipid little nanoparticle. That's what gets injected into your shoulder. And then the mRNA is released into your cell, where this organelle called a ribosome helps manufacture the protein. Your spike proteins are expressed, your body recognizes that as foreign, it starts to build antibodies against the spike protein. And if you get exposed to the coronavirus, basically what these antibodies do is they block the spike protein from binding to your ACE2 receptor. And the spike protein binding to this ACE2 receptor is how the virus is able to enter your body. So by the antibodies blocking this binding interaction, the virus can't get into your body, and therefore you won't be infected. Or if you are infected, it won't nearly be as bad as it would be if you weren't vaccinated. So we're just going to bust a couple of common myths about the COVID vaccine. There can definitely be a lot of hesitancy out there because there is also a lot of misinformation. So we kind of want to do our best to tell you what you might be hearing, what might be true, and what might be false. So the first myth that kind of circulates around is that the vaccine can give you COVID-19. So mRNA vaccines cannot infect you, nor can the viral vector vaccines. The COVID vaccines we have available to us only provide that sequence for the protein to trigger antibody production. On its own, it can't do anything to you. It can't infect you. The next is that the vaccine was developed with insufficient research. As we've already discussed tonight, the vaccine technology we have available to us today is based on years of research on vaccines. And specific to SARS-CoV-2, which is the coronavirus that causes COVID-19, this is not the first coronavirus we've ever experienced. the SARS epidemic back in 2001 was also a coronavirus. We've had MERS in more recent years. And the similarities of this virus to previous coronaviruses means that we've had decades worth of research on coronaviruses, which have enabled us to develop vaccines so quickly. And the mRNA vaccine platforms were something that was being investigated before COVID-19 came around, and it ended up being an effective way to actually vaccinate you against this disease. So the next myth is if I get both vaccines, I don't need to follow protocols. So things like social distancing, isolation, masking. So the vaccine trials were designed with the intention to reduce death and hospitalizations due to the disease. So the vaccines will reduce hospitalizations by 90% if you catch the disease and you've been double vaccinated. The intention was not to prevent transmission. So though having both vaccines and being in a group of people who are also double vaccinated might mean that the risk of transmission is lower, you can still catch COVID if you're vaccinated. So that's why it's incredibly important that you continue to follow public health guidelines, such as wearing a mask and maintaining social distancing and limiting the amount of social interactions you're having. So a couple more myths. If I had COVID, I don't need to get the vaccine. Well, research actually shows that you get better immunity and better protection from the vaccine than you do from COVID. So the types of antibodies you build and retain within your serum as a result of COVID depends on the infection you experienced. So most people will build up IgM and IgG antibodies, which are two types of antibodies. If you had a more severe or long-lasting case of COVID, you might also develop IgA antibodies. But in general, the research finds that these antibodies aren't really kicking around in your system for too long, and that you actually get better protection from the vaccine. And that also has to do with the titer or what's being delivered to you in the vaccine. You can't really control how many mRNA particles or how many viral particles you're going to produce if you get the actual infection. You have a little more control over that when you get the vaccine. So they're able to kind of trigger this better immune response to produce more antibodies so that you're able to better fight off the infection if you end up getting it after you're vaccinated. So the next is side effects of the vaccine are serious. So common side effects of vaccines, especially like the COVID vaccines, are fatigue, headaches, maybe you have a low-grade fever, some soreness in your arm. Adverse effects of the vaccine are incredibly rare. So a lot of people see the news about the myocarditis and pericarditis and they're quite concerned. Well, 12.6 cases per million doses of the second dose of the mRNA vaccine might result in myocarditis. So it's incredibly rare. And the rarity of this happening, kind of just shows that the benefits of getting the vaccine far outweigh the potential rare harm.
So one number I tend to remember, if you get hospitalized for COVID, you have a 1 in 100 chance that you have inflammation of the heart. If you're in the intensive care unit, between 2 and, it goes up 2 to 3 fold of that number. So you can see that by getting sick with COVID or any or any virus, we know that viruses can precision medicine as best we can, relatively unstable, so it doesn't stay in your system very long. And if you're going to get a problem, you're going to probably get it in the first 30 days of the vaccination. Probably more in younger people because your immune system is better. And I think we're going to learn better dosing schedules for different age groups. It's just remarkable that when the vaccines first came out, it was hopeful that they would decrease severity of disease by about 60%. They outperformed it, and it's roughly 90%. And still, if you're double vaccinated against even the Delta strain right now, there's about a 90% reduction in the need for hospitalization or deaths right now. The disease will mutate, and the vaccines will have to change and gear to the new virus. I think we're used to that over time. So yes, there's bad things that can happen, but people say is the mortality from COVID right now is 2%. 2% is still too high in my mind, but we can pick higher risk people as we know for any diseases as you get older: high blood pressure, diabetes, lung disease, kidney problems. It goes on and on and on. So and as you're going to point out, is that the Delta strain appears to be twice as deadly and 5 times more contagious, and we'll talk a little bit more about that later. So this is remarkably good technology that sends into something called the messenger RNA. So it doesn't get into your DNA. It gets your own cells to make its own um, copies of the spike protein, and your body develops resistance to that over time. Can things go wrong? Absolutely. Do things go wrong? Absolutely. Things have gone terribly wrong so far about COVID. It has killed 26,000 Canadians, and it's killed 4 million people around the world so far, and it continues to get worse. So this fourth wave is basically a disease of unvaccinated or improperly vaccinated people that are getting hospitalized. We will all probably get COVID multiple times the way things are going, but I want to be vaccinated. So I know by being vaccinated, I have a 90% less chance of being seriously ill about this or potentially dying right now. So this is important. The disease will continue to evolve and to change. And thank God for science that it's being able to do this. Is it vaccine perfect? No, but it's remarkable, and we'll show you some more information. I'm just totally amazed how good the research has done, how honest the researchers are. The messages keep changing because the science keeps changing. I get it. I'm not a politician. I promise nothing, but deliver helps. And right now is that what we're trying to show you is that there are so many wonderful vaccinations, and I'm getting them all now. And we'll learn more about that. And Didi, you're wonderful for sharing this. Keep going.
And so as Dr. Curnew mentioned, another myth that we sometimes hear about these mRNA vaccines is that they can alter your genome or your DNA. They can't do that. Our DNA is housed in the nucleus of our cells. The mRNA can't even enter that. So they're kind of just producing this spike protein, which in and of itself is not going to do anything. Viruses are kind of assembled like cars. There's like different little parts that are made along this assembly line. All of them need to be put together for the virus to actually be infectious. Having the spike protein on its own is not going to do anything. And that's why this is quite a sophisticated platform to have for vaccine. So one thing we have to remember is that COVID-19 is really infectious. So when the disease first came about, it was associated with an R0 value of 2. Basically what that means is that if I have COVID, on average, I'll probably infect 2 people I come into contact with. So this R0 of 2 is what we initially had. However, as Dr. Curnew mentioned, this disease has mutated, and the current Delta variant we have is quite contagious. So if we take a look at the actual variants and what the R0 values of these variants are, we can see the Delta variant falls between 5 to 8. So we've gone from me potentially infecting 2 people to, if I catch COVID, I can potentially infect 8 people. So that's far more infectious than we initially thought. But the good news is when you take proper measures like social distancing, limiting your social activities, getting the vaccine, wearing personal protective equipment like masks, you can actually reduce the number of people you can potentially infect. So if you take all of these things into consideration, if we were to try and recalculate the R0 or recalculate how many people you could potentially infect, it would probably be significantly lower. So that's just something to keep in mind. Though you might be vaccinated, it's still really important to take proper measures because we are dealing with a really infectious strain at the moment. So the more measures you can take to make sure that you're infecting less people if you potentially catch it, the better.
So what happens is that one of the things that determines how sick you're going to be is how much virus you get introduced all at once. If you get a few billion particles, you're in trouble. If you get 100,000 particles, your immune system can probably deal with that quite handily. So by wearing the mask, you're decreasing the amount of virus that you're going to blow out onto people. And so it's important. The number one reason to wear a mask is to help other people and to decrease the severity of the disease. So by wearing a mask, we decrease the amount of virus that we're going to spread to the person next to us. And that's important. The best form of ventilation is still being outside. So being with lots of people, not being masked, not being distanced are crucial steps. One time, hand washing is a good idea, but more but more importantly is probably the mask is much, much more important than we first thought of. I remember when we first started, we said, no, we have to worry about washing your hands, which is still a wonderful idea, but this is predominantly aerosolized transmission for the vast majority of the time. And so I'm going to be wearing my mask for a long, long time at this stage. And the number one reason is if I have COVID and I'm asymptomatic or mildly symptomatic, I will spread less virus to Stuart and Aditi and less chance of them getting COVID. And if I do give you virus, I'll give you a lower particle number amount of. So I learned this about different infections. Like if you get a needle stick with someone, say, who had HIV, the transmission rate is not that high. But if you get a transfused unit of blood for someone with HIV, you will get HIV 100% of the time. So particle numbers are really important. And so the mask is really a crucial factor about the social distancing, things of that nature as well. So, and again, look at this, our value is that for every person who has COVID, you infect two. And I remember first starting is that if one person got COVID, another person in the family got it. Now, if one person gets COVID, everybody in the family gets it right now because it's that much more contagious. The Delta strain is a more dominant strain. It took over. So this is actually the number one reason to wear a mask, is to help protect others from severity of disease and also spreading the disease. So, so people who say they can't wear masks, unfortunately, you'll spread more virus, and that's really important to realize that effect. So, and you do probably get some protection, but more importantly, you're protecting other people is the reason. So I take the vaccine to protect myself and others. I wear the mask predominantly to protect others and a little bit of protection to myself. Go ahead, sorry.
Thank you for that, Dr. Curnew. Just highlights the fact that we're dealing with such an infectious strain. And you know, it's been a very long year, very long time in this pandemic, but the only way we're going to be able to kind of get through it is we keep following guidelines and keep doing the best we can to prevent the spread of the disease. So this is a little screenshot that Dr. Curnew shared with me. So we hear a lot of discussion about being a little bit anti-vaccine because you don't have a big trust in big pharma. Well, the vaccine, to someone who took the vaccine as this one vial that you get injected with twice, the medications you might have to take from the lingering after effects of COVID, if you get hospitalized with COVID, is significantly more. So just be mindful of that. You're thinking about, oh, this is a vaccine, I'm not really sure about it. You are probably likely going to have to take a lot more medications post-COVID if you have a severe case of the disease, whereas the vaccine is quite honestly a little jab to help protect you.
So the economics of COVID, if you go back, is that if I'm big pharma, I don't want you vaccinated. I can make a lot more money you getting sick. I'll repeat that. If this was all about money, is better to get everybody sick and then treat them with shitty drugs. The drugs we trying to fight virus is very hard because virus uses your own machinery to reproduce itself. So it's harder. Antiviruses don't work nearly as well or work very, really poorly. The only effective really antiviral agent that we have right now is steroids, Decadron. This is a story that there's a big suppression immune system. It only works well if you're really sick, when you have this so-called cytokine storm. It works if you don't have enough oxygen in your bloodstream, you're in the intensive care and you're very sick. It actually makes you worse if you just have mild disease. So there's lots going on here about this. So and a lot of these drugs that we treat, these cocktails, don't work that well. They have a lot more side effects. So I'm looking at this slide here is that there's just no comparison. And again, a good doctor on the far right treats disease. A better doctor prevents disease. A smart person prevents the illness. So things like masks, social distancing, good ventilation are important. And the vaccine is right now for many diseases. So thank you. Very important concept.
So these are just two images I have just to highlight how severe this pandemic is. So the one on the left is from an isolated ICU room in a hospital in Maine, so in the United States. On the right, I actually have a picture from the massive outbreak that occurred in India, where the hospitals were so overwhelmed, they were turning common like buildings and spaces into these areas with beds that they could try and nurse the sick back to health with. So um, we tend to think like, okay, the mortality rate of this disease is super high, but the way it's impacted our world is pretty significant. And we do have a way to kind of prevent all of these intense hospitalizations from happening, which is the vaccine. So just want to highlight this is something you should think about if you're kind of on the fence and are thinking about making a decision as to whether or not to take the vaccine. So the bottom line, as Dr. Curnew likes to say, any vaccine you can get is the vaccine you should get. We know from research that vaccine reduces cases of hospitalizations by 90% when related to the COVID vaccine. The Delta variant, as we've already mentioned a couple times today, is 2 times more deadly and 5 times more infectious. And this is the main variant in our fourth wave. If you haven't already been vaccinated, we urge you to think about getting vaccinated and get vaccinated as soon as possible. We do have a video on COVID-19 vaccinations if you're interested in checking that out, and another video that's just on inoculations if you're interested in checking that out as well. And as always, if you have any questions or concerns or would like to discuss the vaccine, we're more than happy to do that at the clinic. So now on to vaccines in the heart. So can vaccines have cardioprotective effects? Well, the answer is yes. So there is this trial, the IAMI trial, which the objective of this trial was to find out if a simple influenza vaccine or flu shot administered 72 hours or 3 days after myocardial infarction or stable disease that had undergone a PCI has an impact on cardiovascular outcomes. So 2,571 patients were randomized to the influenza shot or saline placebo. It was a double-blind 1:1 randomized controlled trial, so a high quality of evidence, a well-conducted trial. The follow-up was at 1 year. So the primary endpoints they looked at were was a composite of all-cause myocardial infarction and stent thrombosis. Secondary endpoints included all-cause death, myocardial infarction, and cardiovascular death. The study was cut short due to the COVID-19 pandemic. However, it did have some pretty compelling results. So when we look at the primary composite endpoint, what it showed is that administering an influenza vaccine 72 hours after MI or PCI reduced the risk of the composite score of all-cause death, MI, and stent thrombosis by 28% compared to placebo. And then when we look at the key secondary endpoints, you're looking at a 41% decrease in cardiovascular death and all-cause death in patients who were receiving this influenza vaccine post-MI or post-PCI compared to those who weren't. So the results from this trial supported evidence from previous meta-analyses, systematic reviews, and observational studies, which showed that having a flu shot could reduce the risk of cardiovascular outcomes in patients who are post-MI or post-PCI. And the findings of the study actually suggest that a flu shot should be part of routine care post a myocardial infarction or PCI.
Just go back, just stop here. So this trial took place during flu season in 4 separate years. You came in with your heart attack and they gave you the flu shot, a simple flu shot that's recommended for everyone across Canada. And so why does the flu have anything to do with having a heart attack? Well, having influenza, again, damages blood vessels, damages lungs, does have its own morbidity. And you can see that everything's connected. That, cholesterol, blood pressure damage vessels. So does viruses. And to me, a lot of big trials were presented at the European Cardiology meeting. To me, this is probably the highlight of that meeting, at least to me. Here is a small, well-done, randomized controlled trial that clearly says If you're having a heart attack or going for an angioplasty, a balloon to the heart, by getting vaccinated with the influenza during influenza season, decreases the chance of you dying by 40% a year later. And in one sense, they're unrelated, but they're totally related. And I think this is why, is that I don't want to get sick. And I don't want to get influenza. I don't want to get pneumococcal pneumonia. I don't want to get shingles. I don't want to get tetanus. And thank God we don't have to see about things like polio, measles, diphtheria. You showed a slide of what hospital beds look like. Hospital workers are tired. Too many tears have been shed. Walking through an ICU with rows and rows of ventilators is terrible. This is preventable. Is the vaccines we have perfect? No, but this is a simple flu shot. Look what it can do. And so you say, well, the mortality is only 2%. Well, you know what? Destroying vessels, brain cells, lung tissue, scarring tissues. If you want to play around with your life, go ahead. When you have something that works, that's effective, that has a low complication rate, life's a balance. If you said, well, I'll never cross the street because I could get hit by a car, it's a pretty boring life. We all want to get on with life right now. And this technology works. So really think about this a lot. I have a lot. Go ahead there, Didi.
Yeah, so it's kind of remarkable to see something as simple as the flu shot has such a powerful impact on health. And there are other studies that help support this. So this study that I'm discussing on this slide was a review of the literature. So it's looking at all of the other studies that analyzed influenza vaccines and like potential cardioprotective effects. And it kind of consolidates all of the data to see if there's a trend there. So basically what the study found is that aging is associated with chronic inflammation, and that's implicated in several diseases, including cardiovascular disease or CVD. Influenza, so the disease itself, causes inflammation. So influenza vaccines can prevent you from getting the flu, or more often than not, they prevent serious illness due to catching the influenza virus. So that reduces the overall risk for inflammation. So if you take a look at the image on the right, so let's look at the influenza vaccination. You get mild stimulation, activation of your adaptive immune system that modulates the chronic inflammatory response, protective effects. On the other hand, you get the influenza infection. That's massive stimulation of your system, exaggerates that inflammatory response because that inflammatory response is part of how you fight off the infection. So massive stimulation of that can lead to cardiotoxicity, which can be quite damaging to the heart. And so this study looked at the pneumococcal vaccine along with influenza. There's some indication that these could actually be taken together or should be taken as part of like a cardioprotective regimen. So evidence suggests that both the pneumococcal and influenza vaccines have these cardioprotective effects. One proposed model of the mechanism is that these vaccines have a specific effect. So basically, if you take a look at the right, the specific effect is you produce these particular antibodies, which reduce the oxidized LDL macrophage uptake. You have delayed foam cell and plaque formation, and therefore there's inhibition of the progression of atherosclerosis. So that's one speculated specific effect mechanism. Another one has to do with a receptor activation and enhanced nitric oxide synthesis and secretion. Nitric oxide is something our body produces to help with vasodilation. So if we think of like high blood pressure, that constriction of our blood vessels, vasodilation is that loosening that kind of allows for that to come down. So those are the speculated specific effects. There are also unspecific effects, and these are related to the actual inflammation caused by the disease. So getting the vaccine should have a mild stimulation on your system, should prevent massive inflammation, should you actually catch the pathogen post-vaccination. So basically, in conclusion, taking the pneumococcal vaccine and the influenza vaccines can be an important part of your cardiac care. And then Prevnar 13, so this is something that Dr. Curnew mentioned. It's a pneumococcal vaccine, and it's recommended to take after the age of 65 or at the age of 65. So different reviews indicate that this has a desirable effect on cardiovascular outcomes and heart failure outcomes. So it's thought to inhibit atherogenesis by inhibiting that oxidized LDL uptake. So that's a specific effect we observed on the previous slide. And it also affects cell-mediated or T-cell immunity. So 2 shots after 64 years can provide you with protection for the rest of your life. So it's a long-lasting immunity when you get the shot for the second time. So essentially what it comes down to is that numerous reviews, trials, and observational...
Can you go back one slide there?
Yeah, sure.
It's interesting, is that when is the best time to get your vaccination? So I'm struggling with this concept, and we tend to wait till we're older because we have more risk or complications. So, used to be called is that pneumonia was the old men's or old women's disease, and that's how you ended your life. But you know what, is that we now vaccinated all our young kids early in life before they actually start school, and they may have immunity for life. Not sure yet. They're being followed right now. And as you get older, once you cross that age of 50 years of age, for most of us, our immune system starts to decay at a more accelerated rate, 60 much greater. And some people are feeling that maybe we should rethink that and get vaccinated earlier. So for instance, Prevnar 13, you should get that vaccination much earlier on if you have risk factors. So you've had a heart attack, you have diabetes, you have high blood pressure, you smoke, you have asthma, you have already a weakened lung system or a weakened immunity. But maybe the best time to get vaccinated may be much earlier than that. And that's an area of active debate right now. So so here's one recommendation, 65. I personally believe you should probably vaccinate much earlier. And so I'm not going to argue when the best time is to get vaccinated, but I think the best time to get vaccinated is the vaccine you can get today. So one thing is that I'm 62 years of age as of today. I've had my first dose of Shingrix. I'm going to get my second one shortly. I'm waiting about 6 months after the last one because there's this initial prime and boost, and delaying that seems to make a better difference for long-term immunity. Prevnar is going to come out with another vaccine that will have more serotypes, but I'm going to get vaccinated shortly this year against Prevnar 13 myself, and so I'm not waiting until I'm 65. I sort of wish I got vaccinated 10 years earlier, but today's a good day to be vaccinated against all sorts of other diseases. Thank you for sharing that.
Yes, so essentially what it comes down to is that numerous reviews, trials, and observational studies have shown that taking the pneumococcal and influenza vaccines have a protective effect on your health and your cardiovascular health. So make sure you take your flu shot every year. I know a lot of people tell me, oh, I took the flu shot, or I didn't take the flu shot. I didn't end up getting sick. Well, still not a bad idea to take it every year. It's there, it's available to you. You can walk into a pharmacy and get it. So make sure that you make that a priority every time you're entering flu season. And then finally, the recommendation is to take your pneumococcal vaccine at the age of 65. Whether that recommendation changes in the next couple of years, people are following it. They're constantly changing the guidelines and trying to develop it to best protect us. So currently it's take it at the age of 65, but keep your eye on it. You might be able to take it sooner. So COVID vaccines and the heart, well, we know from research that COVID-19 causes inflammation. It can damage the heart. High-risk patients are more likely to face significant adverse outcomes of COVID-19 if they contract it. And there is concern out there about the cases of myocarditis and pericarditis as a side effect of mRNA vaccines. But as we've already discussed earlier tonight, these are in fact quite rare. The chances of catching the Delta variant and being seriously ill due to COVID is much higher than having a side effect from the vaccine. So the cases of myocarditis and pericarditis are rare, but if they do happen, it's usually in younger individuals after the second shot within several days of the vaccination. So as Dr. Curnew mentioned, the mRNA is relatively unstable. It degrades pretty quickly. So if you're going to experience an effect, it'll likely be soon after your vaccine. And cardiac issues in a larger time frame post-vaccine are unlikely to be related to the vaccine. So that's just something to keep in mind as well. Dr. Curnew, do you have anything to add for this slide?
Perfect. Well said.
Okay, so just moving on to some key takeaways from our presentation tonight. So as Dr. Curnew has already mentioned, a good doctor treats disease, a better doctor prevents disease. Well, vaccines prevent disease or prevent you from getting the disease or having severe disease. So getting that vaccine gives you protection for the future by priming your immune system to respond to certain infectious diseases. So the smarter thing to do is to get the vaccine so you can prevent yourself from developing diseases in the future. And vaccine hesitancy is definitely something that's out there. It's unfortunately on the rise. Started way back when an inflammatory article on the MMR vaccine was published, which has since been retracted. Vaccines have played a big role in providing us with immunity and reducing the load of serious diseases, things like measles, mumps, rubella, polio. If you are uncertain about getting the vaccine, we highly recommend checking out some of our videos on our YouTube channel where we try to summarize the information in a concise way that makes sense to you. Or, having a discussion with us at the clinic if you're concerned and want to discuss this. If someone you know is concerned about getting the vaccine, research shows that the best way to kind of address these situations is to first listen to their concerns and then explain the facts that you do know. So vaccines are safe and effective. They provide protection. The COVID vaccines have reduced hospitalizations by 90%. The side effects are very rare, things like that, or directing them to someone who's an expert on this topic so that they can actually get all of the information. So just some things to keep in mind if you yourself are uncertain about the vaccine or you know other people around you who are. So vaccines are safe and effective. That's the point we've brought up multiple times tonight. They work by providing a signal to your immune system to build antibodies against a specific disease. The memory B cells that you retain can mount a powerful response to an infection should you get infected in the future, and therefore they provide you with protection. Vaccines are required in both childhood and adulthood. You can access your records and find out what you need through Public Health Ontario. COVID-19 vaccines are based on decades of research, and we know that they reduce hospitalizations and death by COVID by 90%. Any vaccine you can get for COVID is the vaccine to get. And vaccines also have protective effects on your heart by preventing excessive inflammation due to disease.
So if you go back one more slide there. So if you're worried about inflammation of the heart or its lining, you're more likely to have that from COVID than from the vaccine by a huge difference. You showed very nicely that by getting the flu shot, you decrease your chance of dying by about 40% if you have heart disease or just had an angioplasty. 40%. You decrease the chance of having a heart attack or that stent failing by almost a third. That's remarkable. And you showed us the history of vaccines, the morbidities. I will not say to anybody that you cannot get a side effect. I'm not going to guarantee anything. I will tell you is I think we've seen what's happened. We see how the disease has evolved right now. And right now, things like social distancing, if you're sick, stay home. Proper masking are important. One way for this virus to go away, if everybody stayed in one place away from everybody else for 3 weeks, the virus would die. The virus needs a host, and it wants to spread to another host. And so, I don't think the world is prepared to do that. I would be very glad to stay in one place, total isolation for a few weeks, and the virus will go away. I don't think the world's ready to do that. The vaccine does not necessarily prevent you from getting COVID, does not prevent you from transmitting COVID. It does make you have a better fighting chance by boosting your immune system. And by boosting your immune system, you will eventually spread virus more quickly. and you'll protect other people as well and not allow the virus to mutate as easily. So there's all sorts of reasons. But more importantly is that I encourage everybody to get the flu shot this year, to think about whether or not you should get pneumococcal vaccine, get your tetanus up to date, other vaccines, because most adults are not properly vaccinated, including myself. I'm changing that. I hope you do as well.
Yeah, those are definitely important points to remember. So if you've made it through this video or you're watching live and you're thinking, what are some things I can do as action items? Well, the first thing is to kind of know what vaccines you've had. The second is to get your flu shot yearly. Don't neglect that. And if you're eligible for it, get the pneumococcal vaccine as well. And know what vaccines you might need. So we talked about how some vaccines are required in adulthood. So making sure you keep track of that, knowing if you need a DTP booster, or you need that every 10-year diphtheria and tetanus shot, or if you need to be thinking about getting Shingrix. And finally, the fourth thing you can do is if you haven't already gotten the COVID vaccine, we strongly urge you to consider it and to get the COVID vaccine as soon as you can. So we've heard the phrase, what doesn't kill you makes you stronger, but when it comes to viruses, what doesn't kill you mutates and tries again. So that's kind of some motivation to get vaccinated, because if if we have a lot of people who aren't vaccinated, the disease is just going to keep mutating. And if it develops all of these functional mutations that make it stronger, there's possible we can get even more infectious and deadly strains of the disease. And that's something we absolutely want to prevent. This pandemic has been hard enough. We've seen the burden COVID has had in our society, and getting more infectious strains of that and more deadly strains of that is not exactly something we're looking forward to. So please, if you haven't already, consider getting vaccinated. And that's all I have prepared for you today. So if you have any questions, you can feel free to email us at the clinic, and we're always more than happy to discuss vaccines with you. So thank you so much for listening.
Wonderful. The world of vaccines. Now, Stuart, any questions or thoughts or comments that you saw?
Yeah, I have just some comments first myself. I think the one thing that this whole pandemic has really showed me is that for the first time in my life, I think it's really made me realize that this is the first situation where we all need to work together and be on the same team. I've never in my life felt like we've all needed to be on the same team, but in this case, we need to recognize that our actions don't just affect ourselves, but they do affect other people as well. So the one thing that I think we've really done a good job today is recognizing that there are different perspectives on this conversation. You're not going to get anywhere by not listening to other people's perspectives. But once you've listened to each other's perspective, it's important then to consider them openly, explore the research, do your own research, engage with what scientists are telling you, and be critical of the things you see so that you can make an informed decision yourself. I certainly don't think that anyone who's hesitant to get vaccinated would ever want to cause harm to anyone else, but that's the unfortunate reality of the situation, is that choosing not to get vaccinated is increasing your chances of subsequently getting the virus and then spreading it to the 6 to the 8 people that you're now spreading it with the Delta variant. And of course, now we know the Delta variant is twice as deadly and 5 times more infectious. So the spread would just continue to keep on going. And by no means do I think that we all want to be stuck in this situation forever. I think we want to get vaccinated and we want to wear a mask simply because we want to go back to 2018 where we didn't have to think about this all the time. And that's the best way that I like to think about it is, I don't love wearing my mask all the time, and it is uncomfortable sometimes. And but the reality is I'm doing this because I don't want to spread it to other people, and I'd like to not wear this for the rest of my life. So these are sort of the decisions we have to make, and it's important to recognize that vaccines are remarkable in the way that they work. They've been tried and tested for thousands or hundreds and hundreds of nearly 100 years now, and modern medicine is truly remarkable in the way that it's saved so many lives over the years, and especially over the past year, it's saved so many lives from the COVID-19 virus. The last thing I do want to mention as well is that the importance of just being critical of the things that you read. For example, I looked up on the internet today furniture because I'm trying to redecorate my room. And then the next thing that happened when I went on YouTube was I had an ad from IKEA telling me that I can get some deals for some furniture. So why is that? It's because I was looking for it in the first place. So your internet, your social media is curated to what you believe in or what you're looking for. So being critical of everything you see, doing your own research and listening to what the experts are saying is really the best way to make an informed decision. And that's something that we've really urged you to do in today's presentation. And if you are still hesitant, we love having conversations, and we're more than happy to speak with you as well to help you make an informed choice regarding this decision.
Is that there's always someone smarter than you and more intelligent who knows more. And the best way I learn is by finding smarter people who know a lot of experts. So I'm lucky. I have access to people that point me in the right direction. And I'm glad we can share that with you. And other people feel differently. That's great. But I'm truly amazed the power of vaccines in general. So I want you to think about other vaccines. So I've seen bad people with shingles and with misery. Um, Certain cancers have actually been, through vaccination of by viruses preventing cervical cancer has been a dramatic change. Um, in my lifetime, I never thought we'd ever have a pandemic, but I never thought a stupid thing like a flu shot would be so important to prevent a heart attack. Um, Now I'm learning that pneumococcal vaccines also may do that as well. And the only thing is when the ideal time to get it, we can debate about that. But I'm going to vaccinate myself to the hilt as much as I can, and obviously listen to people who know a lot more than I do. Um, and I think I'm smart enough to try to recognize good from bad information. I don't think the average person out there can do that very well. I spent over 30, 40 years learning to understand this information. Let me share that with you. I'm not trying to sell you anything. I just want you to be healthy for as long as you can. I started off as a heart doctor, and I know how to prevent heart disease, how to treat heart disease. And now I realize that a vaccination can actually help heart disease patients. And I also know that getting COVID is not good for your heart. And if you get COVID in recovery, you're going to pay a price probably in the future with more damage to your vessels and early heart disease. Influenza does that, and COVID is even worse than influenza. So lots more questions. Any other comments that we saw on YouTube there, Stuart?
Did you have any commentary yourself on stem cell research? There was one comment about stem cells and the relationship with vaccines. I have my own things that I'd be happy to share, but do you have any thoughts yourself, I suppose?
Go ahead. I don't know. I don't know enough about it to be smart enough. Go ahead, Stuart.
I don't know enough about it myself, but I do read up on what smarter people, like you said, are saying. So stem cell research is, for those who don't know, it's the harvesting of cells from people who are of a young age. And the reason why you want to harvest stem cells is simply because they can transform into many different types of cells. It's something that the adult cells, like myself or Dr. Curnew cells, they can't do that anymore. And that's the remarkable thing about harvesting stem cells. The one thing that you often hear in the States, for example, with the previous within the last few years, there was a lot of funding that was cut in the States for stem cell research, and a lot of it had to do with the way that certain politicians were sort of framing it in the sense that you're harvesting cells from babies, from aborted elective babies. And when it's framed in a way where you mention that you're taking stem cells from aborted babies, it can sort of enact this visceral reaction that oh my goodness, this is really awful. And that's, of course, because we're all human. We recognize that can be something that just evokes a lot of emotion in us. So it's important to engage with how stem cell research historically, over the past 100 years, dating back to the 1930s, has been something that has been used in modern medicine. And it's been used to eradicate one of the things we talked about today, which is polio. It's been used in the making of the polio vaccine, um, which is now, eradicated polio. And there was also, there's some people that say, well, um, the polio vaccine was not effective at eradicating it. It went away naturally. And, that only 10% of people were vaccinated with polio. But if that was true, that's silly. It's not true, because the herd immunity for polio is in the 80s to 90s. So there's no way that only 10% of the population was able to get vaccinated, and that eradicated polio. When in fact it was the vaccine, it was the herd immunity, it was everybody working together to get vaccinated to prevent the spread of it, which subsequently decreased polio over the years. Stem cell research is remarkable. It's been funded in the United States and Canada, I know in the States since the 1950s. And it's just the ethical conversation that sometimes comes up with taking stem cells from fetuses, which can evoke a visceral reaction, and that's the reason why it's so contested sometimes. But the way I see it, and I'm very open to conversations about this, is that if you can save so many lives by making a decision that's not causing any harm to someone that's living, that's the power of modern medicine, and that's the way I see it. That's the way so many experts see it. But of course, there's conversations to be had about that. And I guess I'm always open to hearing from different perspectives.
So one thing is that a great gift to someone is that when you no longer need your organs, donate your organs. So when my life ends, please take my eyes, my cataract, my skin, any parts of my body, except for reusable parts. Now, when it comes to stem cells, those are cells that can actually change and adapt. So one gift to every newborn, if you're a grandma, grandpa, whatever, get stem cells from the umbilical cord, freeze them, and save them, because you may need those stem cells later in life to protect yourself. You can ever give them away if you want to. Right now is that there's stem cell research for the heart, where you try to grow new heart cells, and people have heart damage. They help a very little bit. And there are more off-target lesions, more things that can go wrong in that circumstance. And so it's not here for prime time right now. So my encouragement is to give your parts away when you don't need them anymore. And if someone's a newborn, get stem cells, freeze them, and they may be useful in the future. That's my look at it. Aditi, do you have any thoughts about any of this?
I think pretty much everything I know about stem cells has already been discussed. Yeah, with modern medicine, there's always conversations to be had, because people have different perspectives and the novel therapies and ideas that come about. But I think it's also just important to keep in mind that, these new ideas that are coming into the field of modern medicine are kind of geared at finding like new ways to treat different diseases and conditions. So it's important to just approach the conversation with an open mind.
So what I'm going to do is I'm going to boost my immune system by keeping myself as skinny as possible. I'm going to use whole non-processed food that are rich in natural antioxidants. I'm going to exercise. I'm going to try to keep my immune system as live and functional for as long as I can. I'm going to work on prevention, make sure my cholesterol, my blood pressure is under control, that I don't smoke, that if I have diabetes, I'm going to treat that properly. And I'm going to look at the value of vaccines to prevent things like pneumonias, infections, also prevent heart disease and cancer. We've learned a lot. And I just want to thank everybody for listening in. This is certainly one of these videos that's worth listening multiple times. Please share with your friends and neighbors. This is certainly our opinion, and listen to opinions from people that you respect. I heard things like the vaccines are leaky, and I'm not sure what a leaky vaccine actually means. I know that COVID is a leaky disease that leaks into multiple cell systems. I know that polio is a deadly disease. I know diphtheria, tetanus are deadly diseases. Influenza is a deadly disease. Pneumococcal pneumonia is a deadly disease. Heart disease is a deadly disease. Cancers are deadly diseases, and can be induced by viruses as well. Again, a good doctor treats disease. A better doctor prevents disease. a good patient makes himself healthy, keeps himself healthy for as long as they can. There's no vaccine against aging. You slow the aging process by being healthy for as long as you can. Thank you so much, everybody. Wonderful night. Good night.
Have a good night. Have a good night, everyone.